you want an effective targeting of the chromophores, and this is how you have to choose the wavelength. So, which wavelength for photobiomodulation? If the aim, and this is what you need to memorize, if the aim is to stimulate soft tissues, epithelium, connective tissue, superficial tissue, you use the 635 nanometer. If the aim is to stimulate hard tissues, it is the best wavelength is the 808 nanometer. Okay. And if you have a clinical condition in which you need to stimulate both soft and hard tissue, for example, during a healing process post extraction, during a dry socket, you need to stimulate the bone regeneration and also the healing of the soft tissue, then you use a combination or a dual wavelength protocol, the 635 and the 808 nanometer. So first, choose the correct wavelength, and then we will talk about the parameters. You can memorize 808 is for the deep biology. So articulation, bone, the depth of the tissues. So what are the indications? In general, it is the best wavelength for temporomandibular disorder, pain management, it depends where, nerve repair, musculoskeletal and joint conditions, osteonecrosis and osteoradionecrosis, implant site healing, osteodensification. We're going to see some of these indications. And for as a reminder, the 635 nanometer wavelength, you can always link it to a superficial or a surface biology, surface stimulation used for gingival tissue healing and regeneration, surface ulcers pain, oral mucositis, dysphagia. So dysphagia is the alteration of the swallowing of the patients, hyposalivation, oral herpes simplex, okay? Some kind of viruses. So this is the wavelength that you have to use in order to stimulate or modulate or treat or manage superficial biology, superficial lesions.